3 or 4 days. As far as plans go, I mean, that's a great question for me. We would love surge capacity plans in every hospital, which we don't have, and that's something that we've been pushing in the emergency department for a while. So, we feel that we're underprepared for any type of disaster management in the emergency room, and we're pretty much on capacity at all times. So every day we are overcrowded or at capacity, and so when we get an influx like this, we're pretty much overrun, or we are overrun. So if our fears are, right now we have a lot of healthy patients coming to the ER or with minimal symptoms. If we had significantly sick people on ventilators, we don't have anywhere to put them.
Honest question. Obviously, the major reason California is so concerned is our proximity to Mexico. Let's not deny our proximity and where this is originating from, where we have a public health crisis right now in Mexico. And someone, Amiano, mentioned that documentation, and it was interesting because I was listening to Linda Sean the other night, a major Spanish network, saying if you have signs of flu, you have these symptoms, which, go to your doctor. Well, for most of those undocumented immigrants and 6 million Californians who don't have insurance, you're the doctor right there, the emergency room. You're right where we're heading. And so the issue becomes, given this being originating from Mexico, given our large amounts of folks, our vice chair's area, my area, the Central Valley with lots of farm workers, are we prepared then to really handle this from a hospital point of view, from an emergency point of view? And let me just ask the hospitals very quickly, and then I'm going to have our vice chair ask a question. But is there an estimate on hospital beds are available today, given our plan? Is there? Push your button.
The state has that information. They've collected that and surveyed the hospitals before. The question is if they're prepared. I think it's important to understand that in this type of an event, there's multiple layers, and hospitals are here to treat the most acutely ill. And what we're currently seeing is individuals that have very mild disease, which could certainly be screened and even treated at this point of the phase by local public health. If we had any screening centers, I'm aware that some of our hospitals have set up tents away from their hospital to protect their healthcare workers in the spread of the disease. In a poll that we did yesterday, it was not made clear to us whether the plan is to have any of these screening type centers set up, at least that we are aware of, or that was in the plan.
Senator Alquist had a question, but I want to put it in context. The panels were switched earlier. And let me tell you what the members heard, in fairness. We heard that you talked about preparedness, and we heard there were no surge capacity in emergency rooms, an overall budget in terms of personnel necessary at the county level, especially for public health officers. We heard inconsistent communication with our hospitals and no plan for them in terms of being part and parcel of the response. We've heard from our clinics as well as our emergency rooms that there's no consistent or organized communication with the state at this point in time. We heard that there's a lack of communication with community clinics, particularly in the diverse communities in terms of their language, and they were not able to access gloves from the county level or Tamiflu. And of course, I think we heard throughout this hearing, the earlier panel, that there was very little prioritizing or allocation of resources. That's the context in which we're going to be asking you some questions, because had we not had that panel, we probably would have listened and said, it sounds like everything is wonderful. Now the panel went before you. I think we have probably some questions. I'm going to ask Senator Alquist to begin.
Sure. Nice to see you. You probably will want to get a video of everything we said earlier. So how do you prioritize, allocate resources? This question is not fair, but I think it will make the point I don't expect an answer. So how many masks have you delivered to every provider in the state of California?
We have not deployed our N95 stockpile because we're really just beginning to hear that folks are having difficulty with
strategy or are we in mitigation strategy? Can you kind of give us a big picture where we're at in California?
Thank you for that question. That's been a hot topic nationally on all the media. The pandemic planning uses the word containment to mean if one case occurs somewhere in the world, can we quickly surround it with all the resources possible and contain it so that it gets cured and doesn't spread to the rest of the state or country.
Is that possible in California right now?
Containment
right now?
No.
It's not. Okay, that's
no. We're basically in a mitigation. We're trying to lessen the impact. We have cases flowing throughout the state. There were hundreds of cases probably in Mexico that are flowing in Mexico. So the containment concept is a little.
So we're well beyond containment. So now we're in mitigation.
We're in mitigation.
So what does mitigation mean in a practical sense for you folks who are implementing this?
This week and last week, it has meant literally case finding. Finding those cases, investigating those cases, testing those cases, treating those cases, as well as investigating the circle around those cases. How many people were exposed? What are their risk factors? Do they need treatment? Do they need isolation? Kind of at this stage, it's more of a case-finding mission. As it expands, as it spreads, we will move more into sort of a community mitigation. We won't need to test all the cases. There'll be sort of, at some point, there'll be a presumption that, oh, okay, that's another case. And we'll be moving more towards what does the community need to do to help us eliminate the spread.
And if indeed it does, one of the issues I think we're all reading about is the deaths in Mexico. How does this flu kill individuals? What's so special about it that takes us to that next level?
The descriptions that we've heard in the 1918 pandemic are just graphically frightening. When the influenza gets into the mucous membranes, into the lung and the nose and the mouth, the body responds by exuding fluids to try to fight off this infection. And folks in the pandemic in 1918 literally drowned and suffocated in their own mucus secretions into the lungs. So people were described as just turning blue and coughing up frothy, bloody stuff was just exuding out of their lungs. So a very severe virus and devastating. But at this point, fortunately, at least in this country, the virus is mild. Folks are recovering. We've had 6 hospitalizations, but folks are getting out of the hospital and recovering. Obviously, if elderly or more medically complicated folks catch the flu, we expect to see more illness and potentially death in the state.